go over the Egoscue method for chronic low back pain with a modification for folks that have either wrist pain or balance problems. Before I begin, I'm going to speak a word of life from John 1:16 through 17. Out of his fullness we have all received grace in place of grace already given. For the law was given through Moses. Grace and truth came through Jesus Christ. So the Egoscue method is a method used to help with postural alignment. And chronic low back pain can be debilitating, and it affects many people. And there's different types of low back problems, all from stenosis, which is a narrowing of the canal. There can also be lateral stenosis, where there is decreased space between the facets where the nerves come out. So you can get symptoms of radiating pain. And this is also when the joint can become arthritic. There's also disc herniations, where some of the disc material can be pressing on nerves. So the postural alignment is important to decompress the back and improve the positioning to give you pain relief. So follow along with me, and I'm going to go through this menu of exercises that is found in the Egoscue method for chronic low back pain. And I will talk you through and help you with the positioning as we go through this. So the first one is sitting knee pillow squeezes. And I'm going to use a block throughout this menu. I'm going to use an Ottoman 2 blocks. I'll have a timer, and you can also use a regular chair. So the first one, sitting knee pillow squeeze. So what I'm going to do is sit on the edge of a chair with my knee in line with my hip. I want to squeeze my shoulder blades down and back, and I want to keep my abdominals relaxed. I'm going to place the block between my knees, keep my toes facing forward, abdominals relaxed, shoulders down and back, and then the hip is slightly anteverted, so the pelvis is just going to be tilted slightly forward just to give that natural curve in the low back. And then I'm going to squeeze the block. I'm going to do this 3 sets of 10. So squeezing 1, relax, 2, relax, 3, relax, 4, relax, 5, 6, relax, 7, relax, 8, relax, 9, relax, 10, relax. Taking a deep breath. Checking in, shoulders down and back, sitting upright and squeezing. 1, relax, 2, relax, 3, relax, 4, relax, 5, relax, 6, relax, 7, relax, 8, relax, 9, relax, 10, relax. Taking a deep breath in. And last set, squeezing 10 times. 1, relax, 2, relax, 3, relax, 4, relax, 5, relax, 6, relax, 7, 8, 9, and 10. So that is going to be the sitting with block or pillow squeezes, 3 sets of 10. Then I want to come down onto the floor, and if you can't do this on the floor, you can get onto your bed and use a soft ottoman or a square, a box, something that you can get into a 90-90 position. So the next one is going to be static back with pillow squeeze or the block squeezes. I'm going to get my legs up into a 90-90 position. So I want 90 degrees at the knee, 90 degrees at the hip, and then take the block, place it right between your knees, applying enough pressure just to hold the block there.
And I want to set my timer for 3 minutes and then do 3 sets of 10 of the squeezes. So palms are 45 degrees from the body up towards the ceiling. And while I am here, I want to keep my abdominals relaxed. So I'm not trying to flatten my back into the floor. I want it just to come down and rest naturally there. My palms are up towards the ceiling. I want to get my shoulders relaxed, my neck relaxed. Everything relaxes except just enough pressure just to hold the block. But I don't need to squeeze as hard as I can, just to hold it there. As I'm lying here, I'm going to focus on diaphragmatic breathing. So a lot of times when we breathe, if we're not taking breaths using our diaphragm, we're using the accessory inspiratory muscles in the neck where the shoulders are coming up close to the ear, and we want to draw the air in from the bottom of the rib cage. So when I breathe in, I don't want just my belly going upwards. I also want to expand outward in the rib cage, the bottom of the rib cage. So breathing in. And then a slow exhale. You can exhale through a small hole in your mouth that helps hold the alveoli open in the lungs to keep oxygen in the lungs, or you can let the breath just fall out of your body. But here with my palms facing up, I just want to focus on diaphragmatic breathing. The diaphragm has a fascial, which fascia is connective tissue that intertwines and holds the body together. There's a fascial connection from that diaphragm to the hip flexor, and the hip flexor is attached to the lower vertebrae in the low back. So having deep breaths is going to help the back become more mobilized. So take a deep breath in and all the way out. Breathing in. And exhaling. 19 seconds. So 3 minutes is up. Now we're going to squeeze just like we were doing in the sitting position. We're going to squeeze our knees together and then relax, but still holding enough pressure to keep the block there. So pressing in, 1, relax, press, 2, relax, press, 3, relax, press, 4, relax, press, 5, relax, press, 6, relax, press, 7, relax, press, 8, relax, press, 9, relax, 10, relax, taking a deep breath. Second set, press, 1, relax, 2, relax, 3, relax, 4, relax, 5, relax, 6, relax, 7, relax, 8, relax, 9, relax, 10, relax, taking a deep breath. And last set, pressing, 1, relax, 2, relax, 3, relax, 4, relax, 5, relax, 6, 7, relax, 8, relax, 9, relaxed, and 10, relax. After that, I'm going to do modified floor blocks. So I'll take both blocks. I want a 6-inch height, so I'm going to turn them to be this direction, and I'm going to then lie face down. You can use a towel roll under your forehead, and this is going to be a 6-minute positional hold. You can do this on your bed as well. So onto your stomach, taking your blocks. One is going to rest on each side. You want your elbow to be in line with the shoulder, and I'm going to rest the elbow and the forearm onto the block. I want to take my feet and I want to turn them into a pigeon toe position. I'll set my timer for 6 minutes. I'm in a pigeon toe. Elbows are going to be in line with the shoulder and getting my feet into a pigeon toe position. Relaxing my forehead onto the floor or using a towel roll, and then holding this position for 6 minutes. You may feel a difference from one side to the other depending on if you have a hip restriction. You may feel a stretch across your chest, and you want to hold this and work on your breathing as you're holding. So 6 minutes while I'm in this position, I'm going to work on the diaphragmatic breathing. Breathing from the bottom of the ribs, and then a slow exhale. I want to try to stay relaxed in this position as best as possible, relaxing the abdominals and taking deep breaths in from my diaphragm. Keeping the neck relaxed. When your forehead has pressure on it, it helps the upper trapezius muscle relax, and that's going to be a muscle that goes from the neck and attaches down into the collarbone. So applying pressure to the forehead is going to allow the neck to relax. Taking a deep breath in, all the way out. Breathing in. All the way out. Breathing in. Deep breath in. And the length of time for holding is important. So I do want to hold for the whole 6 minutes. We're over halfway there. And I'll bring my toes to make sure that the toes are just contacting each other, and then allowing the heels to turn so that I'm in a pigeon toe position. Everything is relaxed, taking deep breaths. Okay. Next exercise is going to be the static extension. So the modification for this, I'm going to keep my elbows right underneath my shoulders, walk my elbows out so that I can get my hips shifted 6 to 8 inches in front of my knee. I'm going to drop my head down, let my shoulder blades sink to the spine, and slightly tilt my butt towards the ceiling. I'm going to hold this position from 1 to 2 minutes, and this is going to be the modification for static extension. So holding here, I'm going to hold this position for 1 minute, and then I'm going to show you the original static extension. So I'm shifting, relaxing my head, tilting my butt towards the ceiling, and holding this position for 1 to 2 minutes. Same thing, you want to keep the abdominals relaxed and work on your breathing in this position, taking a breath in from the bottom of the rib cage. And I want my elbows to be under my shoulder. This is going to align the spine and decompress the back, taking deep breaths in. After you hold this for a minute to 2 minutes, we'll do the next one, but this is going to be the original static extension. What you'll do is you're going to use an ottoman. So you want to come up onto a little bit of a higher surface. I'm going to kneel comfortably on the surface, so you want it to be comfortable. Walk my hands out so that my hands are underneath the shoulder. My hips are going to be shifted 6 to 8 inches in front of my knee. And then I just want to drop my head down, let my shoulder blades sink to the spine, and then tilt my butt slightly towards the ceiling to have that curve in the back, and just hold this position for 1 to 2 minutes. So this is the original position. The first one I did is the modification. This can be hard on your wrist if you have wrist problems, and also finding a safe place to do this is also another obstacle. So the first one I did can be a modification to the static extension exercise. And here, taking deep breaths in. When I complete the static extension, I want to go into air bench. And air bench is a wall sit. So I'm going to keep my toes facing forward. I want to drop down to as much of a 90-90 position as I can get into. And I want to keep my abdominals relaxed, but I'm going to push through my feet. So I'm going to feel the quadriceps, the top of the thighs working. And I want to push I want to have my low back contacted onto the wall if I can. And I want to relax my arms and hold my back up against the wall. You do not need to force your head up against the wall, but I want to keep the small of my back on the wall. And I'm going to hold this for 3 minutes, 1 to 3 minutes. So 1 minute is a good place to start, and then just adding time as you're able to lengthen the amount of time on the wall, and you will get stronger in the legs. So here again, I'm going to take deep breaths in using my diaphragm. So keeping my abdominals relaxed, expanding the lower rib cage, and exhaling. So it's been over a minute. So that's where your limit is now. That's been a minute, and we're into our second minute. Take a deep breath in. All the way out. You should feel the quadriceps working. Toes are facing forward. The lower back is pressed up against the wall. Equal weight pushing through both feet. 20 seconds, and that'll be 2 minutes down. Taking a deep breath in. All the way out. And into the last minute. So that's 2 minutes. You can come out of that. We're working on our third minute. Taking a deep breath in. All the way out. Deep breath in. 30 seconds to go. And 10 seconds going. 5, 4, 3, 2, 1. Okay. Then what I want to do is go into static back. So I'm going to go back into that 90-90 position. You can use a regular chair and go onto the floor, or again, you can do this on your bed. So we'll go back into that 90-90 position. This is static back, and hold this for 5 minutes. Palms are going to be 45 degrees from the body, facing up towards the ceiling. You want to let the low back relax down to the floor. You're not forcing it there, so abdominals stay relaxed, and taking deep breaths in this position. There's no block between the knees on this one. This is static back, just resting in that 90-90 position, working on your diaphragmatic breathing, breathing from the bottom of the rib cage. Deep breath in and exhaling. Deep breath in and exhaling. Deep breath in, exhaling. Breathing in, all the way out. Checking in with your shoulders. You want to keep the shoulders away from your ears. You do not want to use the scalenes to bring the air in. You want to use the bottom of the ribs to bring the air in. It's a good time to let the mind relax. Focus on the breath. Our sympathetic nervous system is our fight or flight, and those nerve fibers are adjacent to the fascia in the low back. So if we stay stressed or tense, that can fire those nerves, and there's contractile properties in the fascia, so that can explain some of the tension that is held in the low back when under stress. So getting into that parasympathetic rest and digest mode is also going to help relax the back, decompress, and allow it to align. So getting into that relaxed state and as well as aligning is beneficial. Working on deep breathing. You're over halfway there. 1 more minute to go. Letting everything sink down to the floor. Hips go heavy, shoulders go heavy. Relaxing the neck and the head. Taking deep breaths. Three, two, one. Next is supine lying. If you have a disc herniation or a disc injury, this is not recommended as this can exacerbate the problem. Or if you have incredibly tight hip flexors with stenosis,
This is also can be an uncomfortable position. So I only recommend if you can do this without pain. Skip this particular exercise if you are having pain. Supine lying, I'll take the block, place it between my ankles and allow my inner part of my foot to contact the block, holding my feet back in a neutral position so the toes are faced up towards the ceiling. And then I'm gonna lie on my back with my palms out to the side, my arms 45 degrees from the body, and the palms facing up towards the ceiling. And I want to keep a slight contraction in the thigh to hold the leg straight, but I'm not doing any forceful contractions. I'm not forcefully pressing the block in, but I'm just holding this position. Now, again, if it's painful, do not do this exercise. Holding here, so I'm going to help the pelvis align with the hip flexor being extended. Palms are up towards the ceiling, 45 degrees from my body. I want to keep my abdominals relaxed. I'm not forcing my back down into the floor. I'll have that natural curve and keeping the leg straight, holding the toes towards the ceiling, and working on the diaphragmatic breathing in this position. Taking deep breaths in, all the way out. This is a 3 to 5 minute hold. I'll do this for 3 minutes. If you can hold longer, you can stay here from anywhere from 3 to 5 minutes. Taking a deep breath in, all the way out. Deep breath in from the bottom of the rib cage. Pay attention to your shoulders so that you're not bringing the shoulders up to the ear. Deep breath in. Deep breath in. Less than a minute to go. As you take a breath in, you should feel the ribs pressing down into the floor and the back begins to come closer to the floor as you take a breath in. And the last exercise on the menu for chronic low back pain is going to be an air bench again. So there's 2 air benches. And this is going to be a 1 to 3 minute hold again. Toes are facing forward, going into that 90-90 position, setting my timer, holding from 1 to 3 minutes. I'll let you know when it's been 1 minute and you want to build up to the 3 minute hold. So here, pressing the low back or the small of the back into the wall and holding this position. I'm gonna feel pressure in my feet so that I'm gonna have the top of the thighs working. I want my abdominals relaxed. So I'm pushing through my feet, activating the quads so that I'm pushing the small of my back against the wall, but I'm keeping the abdominals relaxed. So I'm using my legs to hold the back, not my abdominals. So keeping the abdominals relaxed here. 10 seconds, and that's going to be a minute. 9, 8, 7, 5, 4, 3, 2, 1. So that's 1 minute. You can come out of that, and congratulations, that is the completion. After that minute, we're going to hold for 2 more minutes. So if you can hang in there, keep holding and work on that diaphragmatic breathing as you're holding this. So pulling the air in from the bottom of the rib cage. As you pull the air in, you should feel the ribs anchoring to the wall. You're halfway there, so that's a minute and a half. Should be burning or feel a nice good contraction in the quadricep muscle, top of the legs. All right, 10 seconds, and that'll be 2 minutes in. 3, 2, 1. So that's 2 minutes. 1 more minute to go. Keeping the back against the wall. Almost there. Good job. 30 seconds to go. Small of your back is pressed against the wall. 15 seconds. 14, 13, 12, 11. Out of that. So that is the completion of the Egoscue Method for chronic low back pain, and it is a great routine to help with postural alignment. You will feel the legs building strength. As you do this on a daily basis, the body begins to respond and aligning to decompress and hopefully alleviate some of that chronic pain that you may have been experiencing. And this is with the modification if you do have wrist problems or also a safer position for that static extension. So I hope this is of help and have a blessed day. Thank you.